The Austin Flint murmur is a low-pitched, mid to late diastolic rumbling murmur heard at the cardiac apex in patients with moderate to severe aortic regurgitation. It mimics the murmur of mitral stenosis but occurs in a structurally normal mitral valve. Historically attributed to a single mechanism, modern echocardiography and Doppler studies have revealed that the genesis of the murmur is actually multifactorial. The prevailing classical theory centers on the creation of a temporary functional narrowing of the mitral orifice during diastole. Leaflet impingement. The high velocity retrograde jet of blood from the incompetent aortic valve is often directed toward the anterior mitral leaflet. The physical impact of this jet pushes the AML upwards into a partially closed position. Hemodynamic flotation. In severe AR, the rapid backflow of blood causes a sharp rise in left ventricular and diastolic pressure. This elevated pressure from below the mitral apparatus causes the leaflet to float prematurely towards a closed position. The resulting rumble, as normal antegrade flow from the left atrium attempts to cross this artificially narrowed mitral orifice during rapid ventricular filling, it creates a turbulent flow that generates the characteristic rumbling sound. While functional stenosis plays a major role, echocardiographic studies have demonstrated that the Austin Flint murmur can sometimes occur even independently of rapid mitral inflow. Leaflet flutter. The direct impact of the aortic regurgitant jet on the anterior mitral leaflet causes the tissue to rapidly flutter or shudder. This high-frequency vibration generates low-pitched acoustic shock waves that are transmitted to the chest wall. Collision of streams. The murmur is heavily amplified by the violent turbulent mixing of two opposing blood columns within the left ventricle, the antegrade inflow from the left atrium and the retrograde jet from the aorta. Direct endocardial impact. Some Doppler studies suggest the acoustic rumble can be generated simply by the regurgitant aortic jet violently striking the left ventricular endocardium. Diastolic mitral regurgitation. In cases of acute severe AR, LV-EDP can rise so rapidly that it exceeds left atrial pressure during diastole. This pressure reversal forces the mitral valve closed and can cause a brief period of diastolic mitral regurgitation, which contributes to the murmur's acoustic profile. Differentiating Austin Flint murmur from organic mitral stenosis. Because both conditions produce an apical diastolic rumble, bedside differentiation relies on associated auscultatory findings and provocative maneuvers. First heart sound is soft or normal due to premature mitral closure in Austin Flint murmur of severe AR, while in organic mitral stenosis it is loud. Opening snap is absent in Austin Flint murmur, while it is present in organic mitral stenosis. Amyl nitrate inhalation decreases murmur intensity because vasodilation reduces afterload and AR volume, while in organic mitral stenosis, it increases murmur intensity because of increased heart rate and flow across the mitral valve. Echocardiography hallmark: high frequency diastolic fluttering of the AML in Austin Flint murmur due to severe AR, while in MS it is thickened calcified leaflets with reduced motion, hockey stick appearance.